Welcome, everyone. My name is Jessica Cliff. I'm the Senior Environmental Health Specialist with the Natick Health Department, and we are glad that you could all be here today. We do have a grant from the Metro West Health Foundation in regards to mental health, and these are some of the things that we want to do as a community, is to have a community approach to mental health and be able to have these conversations around mental health, reduce stigma, educate. We have a wonderful panel tonight that will help with that and their expertise. Just a few things, just quick housekeeping. Light refreshments in the back. There's plenty of resources that are here if you want to check them out at the end. Bathrooms are just right outside this door, right around the corner. And I think that's it. So I'm going to go ahead and introduce our panelists. I'm going to start from the end and work my way down. So first we have, so I'm just going to start with introductions, and then I'll have Annette do questions. So Andrea Geller, she is an LCSW, has been a school social worker at Natick High School since 2002. In her role, she provides school-based counseling, crisis intervention, and referrals to community agencies while partnering closely with students, families, and staff to promote emotional well-being and academic success. Before joining Natick High, Andrea worked for the Massachusetts Department of Families, where she supported caregivers and children, collaborated with courts, and coordinated services with community agencies. Her extensive experience in both child welfare and education has shaped her strengths-based, relationship-centered approach to supporting young people. Andrea holds a Master's of Social Work from Boston University and a Bachelor of Science from Lesley College. She is a licensed certified social worker and is passionate about helping students build resilience, self-advocacy, and coping skills while fostering safe, inclusive spaces where all students can thrive. I have next Lauren Mazzola, is a Senior Director of Community Behavioral Health Centers and Outpatient Clinics at Advocates, a nonprofit organization committed to providing accessible mental health care. In her role, she oversees a network of clinics that serve individuals from ages 3 through adulthood, offering support for a wide range of behavioral health needs. Advocates follows a no wrong door approach, ensuring that community members receive care when and where they need it the most. Clinic locations include Framingham, Marlborough, Harvard, Worcester, Whitensville, Plymouth, Lawrence, and Peabody. Lauren brings extensive experience in clinical practice and program leadership. Prior to joining Advocates, she served in various roles at South Bay Mental Health, including clinician, team mentor, and site director for Fall River and Brockton offices. Her background includes working with older adults, individuals with developmental disabilities, and children in residential care settings. She holds a Bachelor of Arts degree from Bridgewater State College and a Master's of Science in Mental Health Counseling from the University of Massachusetts, Boston. Next, we have Cindy Carter. Cindy holds a bachelor's degree in law from Suffolk University and a master's of science in criminal justice and criminology from Northeastern University. Early in her career, Cindy served as an intake coordinator from the Worcester Community Action Council, where she worked with high-risk youth to connect them with meaningful summer employment opportunities. She also gained valuable legal experience as a family law paralegal with the Volunteer Lawyers Project, assisting families through the complexities of legal process. Following her academic pursuits, Cindy served as a counselor at MCI Framingham and MCI Walpole before advancing to clinical director at the House of Corrections under the Spectrum Health Services. In that role, she implemented an anti-recidivism program, thank you, on reducing incarceration, and promoting successful community reintegration. Cindy currently serves as the Jail Diversion Program co-response clinician for the Natick Police Department, where she continues her commitment to supporting individuals in crises and fostering safer, more compassionate community outcomes. Next, we have Tara Brennan. She is an LICSW and has been in mental health field for 25 years. She worked in human services with Advocates for the beginning of her career, working in supported housing and then transitioning to running a DBT group home. She then went on to work at a supported apartment complex in Metro West region. She has also worked as an in-home therapist as part of the Advocates community-based health initiative team. Tara was a social worker for the UMass Adolescent Continuing Care Unit for 4 years, before coming to the Department of Mental Health, where she has been for the last 11 years. In her time with DMH, she has worked in service authorization, running state-operated programs, and for the past 4 years, 4.5 years, she has had the pleasure of running the DMH Westboro site office. We have Lee Rawlings, did I say the last name right? Is a mental health counselor who spent 15 years working directly with youth and their families to reach goals they identified, but needing support to get there. She has worked with all races, economic classes, religious backgrounds, and pretty much every diagnosis there is. Her specialties are trauma and behavioral modification supports. Currently, and for the last 9 years, Lee has worked for the Department of Mental Health, where she is more removed from the day-to-day work with families, but has the opportunity to impact change on another level by overseeing service delivery and policy changes for the Metro West area. We have Scott Munger. He is the CEO of Arbor Counseling. He holds a master's degree in social work from Boston University and is a licensed independent clinical social worker. His prior roles in behavioral health include clinical social worker, evaluation referral service director, chief of social work, director of behavioral service, and market executive director of behavioral medicine for Tenet Healthcare Massachusetts. Scott grew up in Natick and enlisted in the military shortly after graduating high school. He served a total of 20 years, spending 8 years in the Marines and another 12 in the Army. While in the military, he worked in the intelligence, aviation, and operational management fields. Scott's service includes 2 tours of duty in Iraq, 26 months. He retired in 2014, settling back in Natick, where he currently lives with his wife and 3 children. Eric Roldan, Executive Director for Outpatient Services for Arbor Counseling, is a licensed independent clinical social worker with a demonstrated commitment to leadership and direct service to underserved populations. Prior to his current role, he has held leadership and clinical roles in opioid treatment, therapeutic foster care, care coordination, and homelessness support. He is a member of the Leadership Worcester class of 2023 and was named to the Worcester Business Journal 40 Under 40 in 2014. He holds a master's degree in social work from Springfield College in addition to trauma-informed care certificate. Last, we have Mary Morrison, is a community relations representative for the Massachusetts Behavioral Helpline, serving communities in Northeast Massachusetts. The Behavioral Helpline offers direct connection to mental health and substance use care for anyone in the Commonwealth, no insurance needed. Mary has degrees in elementary education and applied psychology and human development, as well as a Master of Divinity. Did I say that right? She has years of experience working as a youth director and teacher. Mary brings passion and empathy to populations she works with. She considers it an absolute privilege to help different populations get connected to resources and the information they need. Particularly, she strives to promote equity and access to behavioral health resources, especially for historically underrepresented populations. In her free time, Mary enjoys game skiing hikes with her wife and her dog. So let's welcome our panelists for today. As you can see, they have quite an extensive background and knowledge that we're really lucky to have them here. So we're going to go ahead and have Annette ask the questions. Thank you, Annette.
Certainly. Good evening, and thank you all for being here. My first question, and this is for everyone, how does your organization support those seeking mental health care, and how can you support those in our community? Should we start with Andrea and we'll work our way down?
Oh, sure. Okay, I'm just going to reread the question because I wasn't sure we were going in order.
Sorry.
No, it's fine. Good thing that we have an ice-friendly crowd here. What are some questions that somebody should ask when looking for a mental health counselor or therapist? Insurance coverage, prior experience with similar patients. So I think people should find out what they're looking for a demographic. I think I'm a little confused by the question. I know that you raised your hand, but are we doing?
No,
We're doing this one.
We're not on
I'm
one.
like, that's not a good.
We're below one. We're above one.
Oh, there's no number 1.
That's why it's everybody.
Got it. Oh, okay. Well, that I can answer very easily. So I work at Natick High School, and I can talk about the high school. And if anyone has any specific questions about other schools or other levels, I'll be happy to get the question for you and then direct someone back to you. But right now, Natick Public Schools at the high school level and all schools support kids in schools. Anyone can have access to school-based counseling. I'm a social worker there. There's other social workers, school psychologists, guidance counselors. primarily students who have an IEP, an individualized education plan, who might have counseling on their IEP. They're sort of the first line for me because I'm in the special education department. But any student at any time can seek out support, and we make referrals to outside community agencies.
Thank you.
Hi, my name's Lauren Mazzola. I oversee the community behavioral health centers for advocates and the outpatient clinics. The community behavioral health center that is closest to here is over in Framingham. Used to be a tropical fish mart, and now is our local community behavioral health center. The purpose of the community behavioral health centers are to break down barriers for getting access to mental health care. I've been with advocates for 10 years. I can talk quickly, so I'm purposely slowing myself down. My passion project at working with advocates has been quick and timely access for those seeking help. I am a firm believer, and Advocates is a firm believer, that if you make that brave decision to reach out for help via either walking in, calling, emailing, we want to make sure that you get the help that you need, right? So, and that starts everyone that walks in the door that works at Advocates, we call it the Advocates Way, is a therapeutic touch. Meaning you walk in, you talk to the admin, they treat you a certain way. You speak with a peer support, they treat you a certain way with respect and dignity and with your voice. We treat people at the CBHC in all of our clinics, ages 3 throughout the lifespan. The purpose of the community behavioral health centers is, like I said in my intro, a no wrong door approach. You walk into our clinic over on Route 9, the old Tropical Fish Mart, and you can have access to outpatient treatment, group therapy, psychiatric medication services. We have a nursing team on staff, care coordinators, recovery coaches. We have a pharmacy on site as well. We have our psychiatric emergency services and 6 crisis beds. So the whole purpose is if you walk in, you're not going to get turned away. You'll be offered something before you leave. So I'm proud of that, and I'm proud of our access to care. I don't want to toot our own horn. We always have things to work on, but that's what we do.
Thank you.
So I'm Sydney. I'm the co-response clinician. I'm also employed with Advocates, so I will just ditto to what Lauren said. But what I will say about seeking mental health, I am embedded in the police department, so a lot of times when I'm responding with officers, that is someone that's seeking mental health support or any other sort of crisis support. And through my role, I'm able to assist with streamlining some of those cares, whether it's a referral to a CBHC or to some other statewide agencies, as in DMH or DDS or any other supports. So my role is essentially kind of bridging the gaps together to make sure that people have inclusive and all-around care.
Thank you.
Hi, everybody. I'm Tara Brennan, the Westboro Site Director. So in terms of mental health care, when someone comes to our office, which anybody can come to our office, we're open during normal business hours, we usually meet with the person and assess what's going on, because it's very possible that they may not need a DMH service. They might need the CBHC, or they might just need an outpatient, a therapist. So we kind of just meet with them and figure out exactly what are they looking for. And then if we determine that they did need a higher level of service that we have, that's when we would sit down with the person and help them fill out an actual application, because our application process can take up to 90 days. So we're kind of the opposite of the CBHC, but to get our services, there has to be a full, clinical review to make sure people meet our criteria. But again, we would suss all that out and make sure that the person is getting whatever they need for an immediate response, and then we would also think about the long-term issues that we would need to address as well.
Thank
I don't
you.
know if you want to add anything, Lee.
Hi, I'm Lee Rowlings. Clearly. I would just add, just kind of reaching out to us is helping to kind of navigate the system, because often people call us or come to us when they're in crisis or struggling, and everyone's giving their opinion to them, and we want them to network their family and their friends and their community, but people know their story. And we know the system. Our job is supposed to be knowing the providers in the area and where and how to go to what. So coming to us to help navigate that is crucial. So you're not running in circles or being told this is the answer and then they say no, and not giving you a direction of where to go.
Thank you.
Right. Good evening. I'm Scott Munger. I'm the CEO of Arbor Counseling Services. Arbor Counseling Services is a community mental health organization, so we run community mental health centers. We're located in about 8 locations all throughout Massachusetts. We have locations in Worcester. We have one down the street in Franklin, which is really good for the Metro West area because it's opposite traffic. So if you're taking your child to a program of ours or something like that, you basically get to drive down the road and watch the wall-to-wall traffic on the other way. So down in Framingham, then we go down to Fall River, we're out in Norwell, in Alston, Woburn, Lowell, and Haverhill. Each one of our locations are basically the same type of setup. So we have outpatient therapy, psychiatry. We do a lot of work inside some of the school systems. We work with some of the school counselors, predominantly in the Franklin area. We have stuff in Woburn now, and then also in a lot of the Boston public school systems. And then we do our day treatment programs. So we have mental health day treatment, partial hospitalization programs, intensive outpatient. We do substance use treatment as well, some structured outpatient addiction programs. And then one of our specialties specifically in this area is going to be things for child and adolescents. And then I guess one of the big takeaways from this panel that we want you all to understand is that there's a lot of resources out there. There was a time at which resources were limited, the system was overtaxed, but we've built this infrastructure and professionals and navigators and everything to help you. So if you indeed need help, enter at some point, reach out to someone. There are things available at every level, so thank you.
Thank you.
Yeah.
My name is Eric Roldan. I'm the Executive Director of Outpatient Services at Arbor Counseling. So I think one of the, Scott kind of mentioned that most of our services that we do, so our outpatient clinics are really trying to break down barriers for mental health treatment and meeting people where they're at from different varieties of support from DBT, CBT, art therapists. I think we have over 200 clinicians throughout our 8 locations, so we're able to have and fine-tune treatment for your specific needs, and really trying to break down barriers of traditional brick and mortar and meeting people through telehealth in school systems, in nursing facilities, and in some housing facilities as well.
Thank you.
Hi, everyone. I'm Mary Morrison. I'm with the Massachusetts Behavioral Health Helpline, which is a free resource launched in 2023. And we actually are all part of Massachusetts' larger roadmap for behavioral health reform, alongside resources like the community behavioral health centers, like advocates, with the kind of goal that we want to make behavioral health resources and broad umbrella of behavioral health resources more accessible to people in Mass. So we consider ourselves kind of a virtual front door to getting connected to resources. This could be basically any and every resource under the umbrella of behavioral health. So in the past in Massachusetts, where a lot of people were kind of siloed in their needs, or told, you go to this number for this resource, this number for crisis, or this one for routine. We try to be one place to really just help get the foot in the door, help you navigate it, ask questions, and that could be anything from crisis care, where part of the state's goal is reducing unnecessary 911 calls, emergency department visits, when there's other options. But it also could be totally routine. So that could be providers calling for a list of resources a little outside their usual wheelhouse. It could be somebody with an uptick in anxiety. You could call for a family member, a friend, just food or housing resources that affect our behavioral health. So really, really broad umbrella we can help you navigate.
Thank you. Great answers. And wow, a lot of resources out there. Now, when someone is starting this process of trying to get help for mental health, it's a really hard and overwhelming process, let's be honest. What are some of the questions that someone should ask when looking for a mental health counselor or therapist? i.e. insurance coverage, prior experience with similar patients, clinical approaches? Who would like to answer that? Okay.
Lauren again. I definitely think call and ask, is your insurance taken in that place? I also think, do you have anyone with this type of experience with what you're looking for? What are their clinical experiences? What are their backgrounds? I'm also a big fan of what are the personality styles of some of your therapists who are available. You can have therapists with all the clinical background in the world. However, if the personalities don't match, it's not going to work. I think I'm the biggest thing since sliced bread. However, I'm not everyone's cup of tea. So I worked with children with behavioral needs and their parents specifically, but I didn't work well with every type of kiddo, right? So I think a lot of the things is, what are the personalities of the therapist? If you think your kiddo or you personally work with a certain type of personality, you should ask if that's available. I also think when you're calling and reaching out for help, you can tell right away by who you speak to what type of place this is going to be. I know I personally have walked out of places because they didn't speak to me very kindly. So if you call a place and you get a good feel from the receptionist and they take your insurance and they have the type of personality of the therapist, I think that's a good fit for you.
That was great. Does anyone else have something to add?
Yeah, I get some. And then the one part about whenever you're choosing a therapist or working with a therapist is going to be, give them a couple sessions. So sometimes it takes time. There's a lot of apprehension on the side of the client or the side of the therapist. You're trying to build what we call a therapeutic alliance. And all of us, one of the things that we quote a lot of times is that 80% of clinical outcomes have to do with that therapeutic alliance. So if indeed you're working with a therapist that you might not be meshing with the right way, don't throw therapy away, just try to get another therapist. And then any clinic that you're working with will work with you to find the best fit for you. So,
That's great.
Yeah.
Does anyone want to add something, or
Just to
should?
chime in off that, I have a 3-time rule. The first time, the clinician might be off, the second time, you might be off, but by the third time, if you're both still off, you're not meant to be together. But also just to kind of piggyback, when it comes to even youth getting a therapist, kids size up adults real fast. And so if they don't look cool to them, they're not going to engage no matter how cool that person really is. So I often tell families and kids to kind of look at online at their picture, and do you even look like you feel like you're going to be comfortable, because that is huge for a kid to then start making that step. It's scary going to outpatient and doing those things, so it's just a way to help ease and give them some control in their treatment.
That's all really helpful. Does anyone else want to add anything else? Or should I move on?
Yeah, I just always like to say it's always like finding a barber or a hairdresser, right? It may take a few times to find that right fit, and so always giving that chance that, yes, this person might not be the right fit, so let me try someone else, and not give up on getting treatment and help and support.
Great.
I'll just add on, if taking a step back, if you need a bit of a matchmaker in terms of finding those resources, we'll actually ask those questions for you when you call, like what insurance do you need, what languages, is there a specific type of background you'd like in provider or thing they specialize in. So that's one of the primary reasons we get calls. So if that step alone is what's intimidating you in terms of getting connected to someone, good chance to call the BHHL or
Great.
check us. We have a database too online that's publicly accessible for everyone at Mass Helpline. I could give more information in the back there.
That's great. Thank you all. What mental health services are available in the Natick area that community members should know about? One I have heard about, but I don't really understand much about, is a Metro West Care Connector. Also, are there specific resources for individuals in the LGBTQ community?
Sorry, I'll talk all day long, so I'll pause after this. So the Metro Health Care Connector is a local resource in the Metro West area. It's actually a partnership between SMOC, Spectrum, Advocates, and Wayside. The Metro West is one of the few communities I've worked in that they've actually partnered together. They have it. It's not competitive, which I've come from places where it's like that. What it is, it's a service that you can call that they can find you the services that you need in the area, and then they give warm handoffs. They also will assess you for different social determinants of health, and for those of you that are listening are like, what are you talking about? It's, do you have primary care do you need one? Do you have food? Do you have anything else going on with you? And they'll call you, talk to them, and they have relationships in the community. The director, Shannon Ahern, works really, really hard at those relationships, and they will refer people people out and then do warm handoffs to make sure that person connected, right? Shannon's gonna laugh. She'll call me and I'm like, oh, they're calling me again, right? But what it means is they're doing their job. They'll say like, has this person been connected? Are they doing this? They'll also make sure that what they're talking about, making that brave step of reaching out, is that they can help do those steps for you. You call and you say, I want a clinician that has this personality with this background. They have those connections. She'll call me and say, I know you have a clinician that has a background in anxiety for little kids. Like, does this clinician have openings? I say yes. I take the referral. I get an intake. She'll call back and then call the family to make sure that it got done. So it's a really great resource in the area, and they leverage their relationships. We have meetings with them constantly. They follow up really closely with people. So it's a really great resource.
Thank you.
Some other resources that we have are also through Wayside from the Framingham Resource FRC, and they are also designed to really help connect people, get services in place, and look at kind of all those basic needs to make sure someone is taken care of. There's also Tempo, which is a young adult access center in Framingham, and they cater to kids that are 16 to 26. And they really help support kind of identifying what are they looking for. Do they need housing? Do they need to learn how to get a job and apply to jobs? They really help kind of guide through the system. There's a consulting therapist that goes to the program, housing specialist, education specialist, and peers that really help make people feel more comfortable moving forward.
Thank you. Andrew.
I just want to second the Metro West Care Connection. In the public schools, we often refer families out to them, and so I can speak from firsthand experience how responsive they are to families. We'll call, we'll sort of bridge the connection. We also have a contract with Care Solace in Natick, which is an online referral service. So school personnel can make a referral. They actually call their service a warm handoff. So we'll oftentimes make a referral for a family, and then once we do that, we're out of it. And then families don't feel like we're sort of micromanaging or playing middleman. So we use that service. We also have a contract with a new service called Cartwheel, which is specifically designed for the multi-language learner population. So we can make a referral for them. I think most of their services are online for therapy, and they cap at about a year working with families. And then I want to just answer the second part of the question about the specific resources for an individual in the LGBTQ community. I can't really speak for adults. I'm sure there's lots of adult-focused people at the other end of the table, but we have a lot of kids who utilize resources from out Metro West, and they can help kids get referred, if the kids are looking for an individual therapist, but they do also a lot of group work with kids, and
A lot of socialization.
I was just going to say they have a lot of groups. The kids find, sort of a community within a community, so I highly endorse them.
I want to second that. Without Metro West, we actually have clinicians that do consultations with them, and they're a wonderful resource. Advocates also does have a partnership with Mass General Trans Health PCP network, where we have consultations with them once a month, and we have clinicians trained and getting consultations from them, so as we want to provide the resources to that population.
That's great. Thank you all. How can we overcome the stigma associated with speaking with a mental health professional and be open to speaking with
If you can come up with a real answer to that, we should give $1 million.
Yeah.
Yes, if it works.
I guess I can go. So I'm Sydney. So in terms of stigma in my role specifically, a lot of times when I'm responding to a crisis, it tends to also become a secondary crisis as well, because you have responders, you have lights, and in some cases you also have ambulance transports. I don't have an answer to how you get rid of the stigma for mental health, but the best advice, I guess, would be to consistently keep talking about it, talking about, the way that a crisis impacted you, but also the people around you as well, and just keep talking about the resources and information sharing. I think sometimes mental health is a gatekeep, like, oh, I found this resource and I'm not going to give it to you, because we're also going through a lot of systems as well, and they're not easy to navigate. So I think consistently talking about mental health, whether it was a crisis or some sort of escalating factor, the more you talk about it, the less it becomes a stigma, if that is an appropriate answer.
It's a great
That's my
answer.
advice. Thank you.
Go ahead.
This is Tara from DMH again. So it's funny, this question, because Lee and I, we go on the road a lot to different schools throughout Metro West, and our table is probably the least visited table. But we keep going because we want people to see that we're not so scary, and we have services, and we want to be there to support people. So we're going to keep showing up, even if we're not the popular kids.
Thank you for continuing to show up, because we need you.
I was just gonna say, just reminding people that mental health is health, right? And just how we're gonna go to the doctors for shoulder pain, we need to go to get treatment for our mental health. And thinking about our language and correcting people in our lives and around our language, right? So thinking about what's wrong with you rather than what happened or what. I think it's the other way around, right? Yeah. So what's wrong with you, use what's happening to you, right? And so trying to make sure that we're supporting people with trauma-informed care lens and in all of our settings and in our personal lives to break some of those stigmas down.
And I think another thing to recognize too is that our society has come a long way. So it's part of our vocabulary in every field. You can even talk about it with sports and, traumatic encephalopathy and TBI and everything, and how the NFL has brought that into, and that's on, Sunday football and everything. So our society has come a long way. So it's the recognition of that, and not to be fearful of being judged when you get in there. All of our spaces are very judgment-free. And one of the things, whenever I'm with a client or talking to people, because they come in there and they have that apprehension, they think that you're judging them, because they think that you have everything together. When it's like, no, I'm one to two life circumstances about being in the same position from you. We always talk, there's a very thin line between provider and patient. And that's the way that we take on this job. So we're here for you. It's understanding that there's a whole group of thousands of professionals out there that will help you, without judgment.
Thank you. That was helpful. For those who with limited insurance coverage or accessibility, such as Mass Health or out-of-state insurance, what recommendations do you have for finding providers or receiving mental health care?
I was just going to say, call your insurance company and see who and where they cover first, because that can open up the door. Sometimes you can get out of, coverage providers and stuff like that. But then also call DMH and have a conversation. Don't just apply. Let's see what makes sense, because because of our application process, we don't want you waiting 90 days for it not to make sense and be approved, when you could have been doing other resources and supports then.
Thank you.
And CBHC.
You can call the Metro West Care VHPMW, and they can tell you who has openings with the insurance that you have. The BHL helpline can also help as well. Advocates, the community behavioral health centers are about 80% Mass Health. Those with Mass Health Limited, MBHP, will pay for 3 sessions, and then we have groups that people can go into and things like that. But you can start with some of these resources that we've talked about, and they can do warm handoffs, tell you who has openings, who might be a good fit for you. And there are resources for those with Mass Health, such as the community behavioral health centers. Advocates also has urgent care centers as well, behavioral health urgent care centers. So,
great. How do you know when your child may benefit from counseling services? For instance, my 7-year-old is always worried about what their peers think of them and have a hard time regulating their emotions. Would they benefit from therapy, or are they just too young?
I think that goes back to the stigma question, right? So yes, if your 7-year-old is concerned and you're worried, therapy can be a blessing, not a curse. And being comfortable talking opens up the ability to keep talking and then not have things exacerbate into destructive mode.
Thank you. Andrew?
I can say from the school perspective that we often encourage parents to reach out to pediatricians and start with your pediatrician, and they can do, any kind of screening, a developmental screening, an social emotional screening, if it's more attention-based. So hopefully families have relationships with their pediatricians. And then, not that the schools are looking for more business, but I do want people to know that it is okay to call, the Natick Public Schools and speak to somebody. In the elementary schools, the guidance counselors act as the school counselors, so they would be somebody that you could start with by calling your child's school counselor. In the middle school, it is the guidance counselor. They also have social workers and school psychologists, as is true for the high school. So I know a lot of times families don't want to mesh their lives. I know this case scenario, this question is coming from somebody regarding a 7-year-old, but even so, a lot of families, there is stigma and there is shame, and they don't want schools to think, anything negative about their family, so sometimes they're hesitant to reach out to the schools. But I just want to really encourage anybody in the room and anybody that might be watching online that, chances are we probably see it. So you might want to, you think you're hiding it, but your child is probably acting out in any kind of a way at school, because school is often a safe place also for kids.
Thank you. Where's the best place to take a loved one who's having an active mental health crisis? I knew that was you.
I can answer that. So I think it honestly depends on the type of crisis and the safety of the individual. If it is when a CBHC is open, it might be beneficial to have a family member or a loved one drive the individual to a CBHC, whether it's advocates related or some other local crisis center. If that doesn't work, you can drive them to the emergency room yourself, safety willing, if it's safe and you feel safe driving them. If not, I would encourage you to call 911. And then they will be either transported or some sort of other plan will be put in place to de-escalate.
Great.
Jim, just jumping off that, a lot of people aren't aware with the community behavioral health centers, we have something called mobile crisis intervention for those that need crisis services. The purpose of that, people get really afraid of that. They're like, you're going to come to my house, you're going to take me away. I want to say 90% of what they do, our psychiatric emergency department, is diversion. So they want to keep you away from the emergency room, keep you away from going to the hospital. They want to make plans with you and then refer you and then follow up with you. They can come to your house. They can do virtual. You can come to the office.
They can come to school.
They can come to schools. So the whole purpose of them is to go out in the community, meet you where you're at, to try to prevent you from that higher level of care. So you're safe, you're in your home. They want to work with you and your family as well.
Great, thank you.
Al, can I add on? Mobile crisis intervention is wonderful. The community behavioral health centers have insurance, blind crisis care, insurance covered. So those can be great resources. If you're ever in doubt of what it might warrant and your loved one, thinking of your loved one, and you don't know, is this the kind of situation that calls for 911 or is it less intensive? The helpline can be a great determinant in kind of figuring out. And often that might be mobile crisis intervention that we'd involve. We could give you your options, talk with a loved one. If you call with the person in crisis, that's a wonderful use of the helpline too. And we can help you kind of navigate what might be the best way to call or to go. If you know you need something like mobile crisis intervention, I would just call them directly, no use for a middleman. But if you're in that period of where do I go in crisis, there are a lot of different options that it might call for, and every situation is different, so we can help in navigating that.
Great, thank you. What does it mean for somebody to be sectioned? And what happens after a person is sectioned? That is.
So when someone is sectioned, essentially what we're saying is, this is such a loaded thing, and I come from advocates, and we have such strong feelings about this, so I'm trying to be careful. Essentially, what we're saying is you need to go to the hospital, right? We might be in disagreement. You might say, I don't want to go, but you're meeting with someone who is saying, like, we think you have to go. You're non-safe for yourself or others. What that means is you typically you will go to the hospital, and then you'll be reevaluated by another mental health professional, and we determine whether or not you go to a hospital or to a hospital. A person can sign, I don't want to get too many into the details, but you can sign something called a 72-hour hold, where then you go to an inpatient stay, and then you can sign, you're essentially saying, I'm signing myself out. However, that is, I know people get really afraid of that, so I want to be really, really very, very clear that we try to avoid that at all costs and work with you and work with your families and work with your supports. Like I said, something close to like 95% of people that go to mobile crisis intervention, we try to use diversionary services, meaning like we refer you to outpatient, we refer you to a partial program, such as like an Arbor partial program. So I just want to be open about that.
I appreciate that.
Yeah, and I can kind of speak on that too. In my current role, like my entire description is to essentially divert. So it's either I'm trying to divert a mental health emergency for criminal charges, or I'm diverting a mental health emergency in which someone can stay in the community. So it's either, providing those referrals, or it's even me calling them later that night saying, oh, how did everything go? For someone to be sectioned, it's like an imminent safety concern. There is no safety planning. It's an inability for someone to completely take care of themselves. So they're not eating, they're not sleeping, they're not, doing the normal functionings of, daily living. And like Lauren kind of said, like the goal is to keep people in the home. So, kind of outsourcing them to resources.
Thank you. Once a person has been sectioned, how can that loved one and mental health professionals ensure that they get the support they need once they are discharged? People often fear that there will not be a seamless transition to from inpatient to outpatient care once someone leaves the hospital.
I can answer that a little bit. I think it depends on how old the person is, because adults have to advocate for themselves. So that's anyone over the age of 18. So if someone comes out of an inpatient admission, like we kind of talked about a little bit, or they come off of a section or an emergency room transport and they don't want the services, that's their decision to just not want the services. But in terms of like seamless transitions, the hospital, advocates and partnering hospitals or, any sort of agency does try and do their best to put in those referrals and do some aftercare, because if you step right down from one level of care, you're not going to have the same support, and it might actually ignite another crisis.
Thank you. Go ahead.
I'll let Leah go. She
Okay.
Oh, okay. I was just gonna say, I work a lot with, the youth that are, under 18 or even 18 to 22, and working with parents to really understand what their rights are going to be once their child turns 18 is really important. Because once they're 18, a hospital can kind of not incorporate them at all. And that's really hard for parents to understand. And their kid could be discharged from a hospital at 18 to the streets, even though they have a home, with no conversation with the loved ones who are going to care for them. And so I really strongly advocate for parents to understand what their rights are. Guardianship does not necessarily always make sense and doesn't get you awarded stuff just because you're concerned about the safety of your child. And so being really mindful of what those options are, like healthcare proxies, to be allowed to be in the room and have the releases.
Thank you.
So from the inpatient side, one of my jobs before, I was an inpatient social worker right here at Metro West Medical Center. So inside of an inpatient unit, there's going to be a team of social workers, step-down navigators, the same thing, psychiatrists, nurse practitioners, and their job is to make that seamless transition. The gold standard of a discharge from an inpatient facility is going to be that you have a PCP appointment or an appointment within 7 days, right? And a therapy appointment and a psychiatry appointment, or a step down into a PHP program or an IOP step down. That's a day treatment, type of program. So that's what people are looking to do. And one of the things when we're working with adults, it has to be voluntary. We can make all the appointments in the world, but if you have a loved one that is inpatient, as long as there's a release of information and there you can participate, I would encourage family members to participate while they're in there and try to get those appointments and, help them and support them while they're in there.
That's great.
Yeah.
Okay. What free screening resources are available to parents and caregivers for elementary school age children who have experienced trauma or may be dealing with anxiety, depression, or ADHD?
From the school side, again, we would encourage parents, caregivers to speak to your pediatrician. Schools can't diagnose. We can say symptoms of anxiety, symptoms of depression, symptoms of ADHD. There is an ADHD screening tool that can come from a pediatrician's office through the school system. We don't get to look at it. It gets filled out by teachers and then gets sent back in a sealed envelope right to the person who's requesting that information, whatever provider. There's also a website. I don't know too much about the Child Mind Institute, but there are a lot of helpful screening tools on that site. I'm just really not familiar. Maybe somebody else is, but I'm not. But I know that's one.
Okay.
I would also just say for kids, there's a website that the DMH oversees called Handhold, and it is a walkthrough of this is what I see or feel, and then it kind of is like a tree where it kind of just keeps guiding you with your questions and answers, and it can help navigate. But you also can look into insurance coverage and neuropsychs, but first you kind of want to start that first step with outpatient and really start building that and see what's going on in that way.
I always want to say to parents too, like when I work with parents, I say, you know your kid better than I do or anyone else. That if you we could take all these screening tools, but if you have a gut feeling, talk to someone about it. If they've got something going on that's impacting them in any area of life, like they're having trouble making friends or have trouble paying attention at school, they're having trouble at their t-ball game, they're too shy to go up to bat and it just feels like it's not right in your gut. Trust your gut as parents. Right. You know your kid better than any of us do. So I know a lot of people ask, is there free screening tools? Like if you're taking the screening tool, you probably in your gut know something, reach out,
That's really important. Thank you. How do schools support families whose children need to do an inpatient program?
Okay. We have at the high school level, we have a program, it's called PACE, and when students return from hospitalization, mental health, we have supports set up for them. It's a classroom right in the high school. It just, it doesn't anymore, but it used to just blend in with the regular classrooms on the third floor, but we have no space in our 10-year-old high school, but that's a whole story for another day. So now it's somewhere else, but regardless, it's staffed by a social worker and an academic tutor. So we do a lot to integrate kids back into school after they've been hospitalized. It's voluntary. Families don't have to take advantage of it. I will tell you that we have students who we know were hospitalized, but they don't disclose it to the schools, and that is a family's right to do that, and they manage it on their own. If families do disclose, we have a variety of supports, not just the PACE program, but we will try to meet students where they're at academically, emotionally. We'll do a reentry plan with them. We can do partial days. If it's appropriate, a special education referral can be made. So we do have a lot of supports. Again, I can only speak for the high school, but I will tell you that I'm so confident that the elementary and middle schools will also work with people.
The middle school actually has the PACE.
Well, yeah, Annette can tell you about the middle school.
And then while a student is inpatient, because I think that's what the question started from, so while you're inpatient, each one of the child development units or an adolescent unit is going to have a tutor that's embedded. And there's companies out there like LearnWell is one of the companies that runs just kind of special education. And their job is the hospitals are contracted with them, but they work with the school system. So your actual school system is what pays for that. And they pick up where the student is kind of left off and ensure that they do that. And it should be about an hour and a half of tutoring per day. And then same thing with our program. So, myself as a parent, introduction, I have, 3 kids. As a parent, I would be somewhat apprehensive. You're looking at your child and they're going through things and it's starting to interfere with their life and their friends and everything, and you're trying to make that decision. Do you want them to enter into some sort of program? Most of our programs, or all of our programs, Advocates, ours, and other ones, they're designed to have embedded, tutoring so that we don't feel like we're losing a place. So yes, we're paying attention to mental health care, but now they're falling behind at school. Now they're going to be, they either fall further behind, it's going to make their problems even worse. So you have supports while you're inpatient, supports while you're in a partial or step-down program, and then reintegration back in school too. So all those things have been built.
Thank you all. How do I combat anxiety in the workplace pertaining to performance and expectations?
Well, we all deal with that, I think.
I would say that a lot of companies out there have EAP programs for employee assistance programs. And those ones are designed to be separate from the company, so you have a level of confidentiality. And then there's all mental health workers and counselors embedded within those EAP programs that can get you the supports that you need. So I would encourage anybody that's going through something related to work or even at work to search and see if they have an EAP program with their company.
Great, thank you. My son has returned from an educational course in April of 2025 and seems uninterested in seeking employment. He's expressed uncertainty about his future and says he's trying to figure it out on his own. He is currently on antidepressants. Attempts in the past to use a therapist have been unsuccessful as he is reluctant to talk to anyone. How do I get him the help he might need?
Do we know the person's age, by any chance?
It sounds like college. It sounds like they're returning from of some sort of beyond high school because they're returning.
This is Tara from DMH. So one of our DMH services, and people don't actually have to go through a full authorization to utilize it, is it's called the Clubhouse service. Ours is Employment Options. It's in Marlboro. And it's a place where people can go to do just this, kind of figure themselves out. And in that, they would go during the day, so it also gives them some structure. And they can do different things, whether they want to learn about other jobs. They can focus on going back to school if they want. The Clubhouse runs a kitchen. They actually run a catering business out of it. And so a lot of people get really involved in the business side of learning how to run a catering business. And it's just a really good place to socialize with other individuals who struggle with depression, anxiety. And it's very flexible. People can come and go as they want. You don't have to be there a whole day. You could go for a couple hours. You could go 1 day a week. You could go 5 days a week. So it's a really flexible service that we have.
Great. There's also Tempo in Framingham through Wayside. Oh,
I was going to say utilizing Tempo would be a great resource. There's also the Parent-Peer Partnership through Wayside, and those are young adults with lived experience that are there, but they run meetups because young adults don't go to groups. And it's a fun way to make connections without the focus being treatment. I call the peers the golden ticket to treatment because they get people comfortable in just being open to talking about things and then just networking and building up their social stuff. And then for parents also, with the parent going through this, reaching out to PPAL, I think they just say PAL, but I forget the P. But it is so helpful for parents that are lost and struggling with managing all these things on their plate.
Thank you.
A couple things. This is a tough situation because, the parent is desperate. They want to help their kid. The kid's probably 18, 19, digging their heels in. And the more the parent does it, the more the kid withdraws, right? It's a couple. I love the peer support idea as well. Advocates has a house on Union Street in Framingham that I'm ashamed right now because it's turning into the living room. Thank you.
Right on Union Street, like a block up from the
Yep.
Rose House.
Yeah, and it's peer run, peer led. People can walk in, no questions asked. Yeah, and it's a really great place. I've never heard a bad thing about it, and I believe firmly in the peer-run group. We've done different things. It depends on how entrenched the kid is and saying, like, I'm not getting help, you know? If the kid is a little bit open, sometimes we'll say, like, can we have permission to call him, right? And then I'll have the type of therapist he might like reach out to them just to say, hey, listen, would you ever want to meet? If the kid is like, no, then we leave it alone. Sometimes we will work with the parent and say, do you want to come in and figure out some different techniques of working with them as well? But I call it feeling the grapes to see which one is soft, right? But sometimes it's the living room. Sometimes it's working with the parents. It's just seeing where the kiddo is.
Great, thank you all. How does the Mass Behavioral Helpline differ from 988 and 211? And how do you ensure that individuals are getting the quality care connections?
Yeah, I can take this one. Makes sense. So we get this question a lot at the helpline if there's all these different numbers, right? Mass 211, 988. We just mentioned a bunch of different numbers on this panel that you call. And I always say there's no wrong door. So if you are getting connection to care and if these resources and numbers are working for you, continue using them. There are so many great resources that are local, that are statewide. 988's a national one. That being said, we each operate a little bit differently. So specifically the numbers mentioned in that question, 211 is more housing resource assistance, some of those basic like social needs that affect our behavioral health. 988 is they do a lot of peer support for suicidal ideation or crisis. Somebody needs to talk to somebody in that crisis situation. The helplines we do multiple ends of that. So we're that one-stop shop. That's a lot of different types of connection to care. But sometimes what that looks like at the helpline is saying, hey, it sounds like what you need is a number much like this one. How about we connect you and do a warm handoff to them and vice versa? We get handoffs from 988 all the time. With the goal being really, you don't all have to know the differences between these numbers, that we're working closely enough that ideally you could call any and get the most appropriate place for you. But those are some of the differences. And again, whichever are working for you, we encourage you to keep using.
Great. This is a similar question, but it's from someone else. What is the difference between 988, the Mass Behavioral Helpline, and the Metro West Care Connection? And that you've described most. Is there anything?
I just think the big thing is the BHL or the Mass Health is statewide, where the care connection is local. Like you get that. The Mass Health has been wonderful.
I would say the same
Metro,
thing.
it's more local. They have local relationships, so they do the local warm handoffs. Like I mentioned her name earlier, Shannon Ahern, the director, she'll call me and just be like, hey, or she'll call someone from Wayside and be like, I got this. She'll call local group practice and say, I think this is a better fit for you, right? So I think the Mass Health is more statewide, where they do the warm handoffs. As a community behavioral health center, we have timeliness metrics that we have to meet with them. Like we have to contact, when we get a referral, we have to contact them within an hour and then accept or reject the referral, right? Where the care coordination, the care Metro West care coordinator, they may have been working with them for a little while and trying to get them the different services, whether it's food, PCP. They may not have insurance and they're trying to work with them with insurance, but they have the local relationships.
Great. Now I'm going to take some questions from the audience. Does anyone have any questions?
I could say something about every single thing that was said up there, so I'll try to. But my name is Kim Holt, and some of you may know who I am. I work for MBHP, and I founded Boston Research Center and was its first director. And the only thing I've really missed up here was any talk about the recovery learning centers. And I know there's not one here, but Kiva Center service here, and people can get services from the Boston one too. And the other comment that I felt really I had to make, and I held on to during when you're talking about sectioning, the laws have changed so much and the rules have changed so much in the last 25 years. I used to walk into the emergency room voluntarily and go into a unit voluntarily. Now I have to be sectioned in that process, which is a legal status. And so you may think, well, It's a legal status. I had denied temporary custody of a kid 10 years ago because I had sections for transportation in my legal history.
Thank you. Does anyone else have any questions?
I know during COVID, wait lists were an issue. Do you feel like there's still an issue, or do you feel like it's better that we are now kind of getting people in a timely manner?
We don't have a wait list at all right now.
Yeah.
At all.
That's great.
We were at the Saturday event in the Natick Common, and that's one of the things that people kept coming up. Oh, it's tragic that there's not enough resources out there and everything, and we're going, you can get people in right now. So all of these providers have grown their networks, have partnered with each other, built different programs. There is a tremendous amount of support out there. And same thing, we don't have wait lists. So, and then if we, for whatever reason we will find something for you. And every one of us is like that, all the different providers out there.
This is Tara again from DMH. Unfortunately, our services definitely have wait lists. So all of our higher services, our adult community clinical service, that's our outreach team, and our group living environments all have pretty extensive wait lists. We're looking at anywhere from 6 months to a year for those. And our program for assertive community treatment through Riverside that does serve out here, that's probably another 3 to 6 months as well, wait lists. So unfortunately, our service structure is has not improved after COVID.
And to chime in just off that, so that's within the adult system. Within the CYF system, I don't have wait lists for the services. But I think it's important to know, like, even when coming to either one of us, we are not crisis interventions. We are, because things have not worked in the community and the other resources haven't worked. So that's partly why there is that kind of timing, is because we're taking people who have significant needs and meeting those needs.
I guess to piggyback a little bit on, it was one ongoing challenge has still been psychiatry and med prescriptions. It's getting a little bit better with Massachusetts has expanded its laws in recognizing nurse practitioners as independent practitioners. And a lot of the schools around here have all grown their NP programs, and there's a lot more being minted every, if we had posted a position, we needed someone, we used to have no applicants, now we have applicants. So that's getting better, but that might be one of the challenges. But if someone's having, depression, anxiety, that's not going to be your first go-to thing. Get into therapy, reach out.
Yeah, I think it's one of those things that it so depends on what you're looking for, the type of resource. Psychiatry, for instance, is one we see a lot that might have a wait list. As soon as you're filtering for, maybe there's no wait list for this type of insurance or for an English-speaking therapist, but as soon as you're filtering sometimes by language or things like that, we can see those longer wait lists. Another resource, the helpline, we try to keep an eye on it. It is a constantly changing, fluctuating thing. So we have a lot of organizations that have no wait lists, and a week later they have a 6-month wait list. But that's one instance in which the helpline can ideally help you navigate it. We also do follow-up calls consistently, so that gives the option of, even when people are living in that reality of wait lists, of having somebody check back in on you, see how you're doing in the meantime, hopefully get you some other resources that are more readily available while you wait for that one to open.
And I guess one thing with the wait list too, don't let the wait list discourage you. If you do call because some people do that. They'll say, oh, it's a wait list, and then people will ask, do you want us to put you on the wait list? And they'll say no. And it's like, put yourself on every wait list. There's going to be a new hire or something like that, and there'll be an opening or something. So yeah, don't be fearful of that. Things are getting better in some senses, but other programs do have some challenges still.
We don't have a wait list for psychiatry now either. However, with the community behavioral health centers, we have to offer something, right? So we have standardized timeliness metrics, and the state checks on us biweekly to ensure that we're meeting them. So if you're identified as high need, then you have to have a psychiatric appointment within 72 hours. So we have to hold appointments for you and then create a plan with you to get you those follow-ups. We have, similar to Arbor, 9 outpatient clinics. So if it's something that even if that specialty isn't in Framingham, we have people in Peabody, we have people in Lawrence, that if you are someone that could and is a good fit for telehealth, then we can work that system with you too. So like he said, don't let anything stop you from coming in the door. We have timeliness metrics. What that means is we have to offer you something, in terms of services.
Thank you. Does anyone else? Yes.
Hi guys, my name is Anne. I just wanted to thank everyone up on the panel for both what you do, like the critical work you do, but for who you are as people. So I just really appreciate that. My question, because I know many of you are clinicians, how is the best way to support if you have friends who are clinicians or providers? Because many of my friends work at Salem Hospital, the psych unit, and pediatric psych unit particularly, and I see like my best friend, like Rebecca, comes back home and she's like, I don't know what to do. I just got bit today. I just got stuck in a restraint that didn't have proper support. So I care deeply about like the clinician side, and I want to see what is the best way to support the opposite end who's doing the work to help the people. Thank you.
Oh, that's so thoughtful of you. Thank you.
I mean, I think for me,
You
I think just providing space, right, and allowing people to share if they want to, and doing things that are not related to work, and having those, let's go for a walk, let's go to the movies, let's go to a concert, trying to have those types of connections with our friends, but always having and opening up that space. And I think folks being able to have good clinical supervision is one of the things that we hold really true to us, is wanting to break down those barriers so people are not bringing those things home and having the space within their work to leave work at work and not having to take on that stress back home.
Yeah, and I will tell you just right before this started, that's exactly what we were talking about, is I'm a lot older than you, and I can tell you that it's really hard to go home and leave work at home.
Mm-hmm.
But if you have to have all those other healthy outlets and distractions, because otherwise your friend is probably your age and is a young person and will burn out and probably doesn't want that, so needs to have other ways to take care of herself. And there's nothing wrong with the helper getting help. Just
Sure.
saying.
Good one. Does anyone else have any other questions?
I just was wondering, I know you were mentioning before about parents coming or people coming up and saying, have this misperception about there being waiting lists, et cetera. I'm wondering, I think there is the perception among a lot of people that there's a mental health crisis, that people that they know are experiencing high levels of stress and have behavioral health issues. And just wondering, what are you seeing in the people that you serve, both young people and adults in the community?
I could start with that. So we know kind of what the story was. So COVID-19, right? Everybody was isolated in the community, right? And then what that did is it sparked a mental health crisis. And we saw that across all of Massachusetts, across all the United States. Inpatient units were overflooded with people that didn't have their medications and didn't have supports and didn't have therapy. So we had this large mental health crisis. And layered on top of this, we had something that was brewing beneath the surface for a lot longer than that. So, and specifically with our youth. So has anybody heard of the book or read the book Anxious Generation? Mm-hmm. So, right. So that's the part that we're seeing, and it's manifested in ways that, social deprivation and, addictive behaviors and compulsive behaviors and all the things that we've seen related to the social media and so we're seeing a lot more of our youth acute and, specifically with like behavioral outbursts and stuff too. So that's been a layer on top of this mental health crisis as well. So we're seeing a lot of that. Luckily, a lot of the public school systems have gotten smart and they're holding, different events and phone lockers and all these other things that have hopefully that they've done a lot to have kids, find some support. So.
Yep, and Natick School Committee just passed that kids must put their phones up in the lockers or out of sight. And there's a lot of emphasis and pressure on staff to uphold that. So please encourage your child or children or grandchildren or anyone you know to put their phones away, because it will help everyone in the long run. But I can just second what Scott said, is that schools are over flooding with kids in crisis. We have, I don't want to alarm people, right? But there is a mental health crisis, and I do think a lot of it does stem from the phones and all of what's happening with kids and social media and vaping, and there are a lot of concerns, and I think it really does. I know that's such a cliche, but I really do think it does take a village. I think kids need to know that there are lots of supports, and I say that as a parent educator, that I can't be all things to my kid, and I don't pretend to be. So I think kids need to know that there are people everywhere looking out for them, and if they find one person that they connect to as an adult, whether it's, the woman serving you lunch, or the custodian at school, or your dog walker, or the school social worker, whoever it is, I think it's just really important that we keep reminding kids that they have people in their corner.
Does anyone else have a question? Does anyone else have something that we've forgotten to include? Because it's important to include everything possible. I want to thank the panelists. This was an incredible evening, and I hope many people got a lot out of it, because I certainly did. Thank you.
Thank you.